Hello, this is Dr. David Green, CEO of the New Jersey Pain Network. Today's topic is the indications for spinal discectomy surgery for sciatica. Sciatica occurs in 1 to 2% of the population at any given point in time. Most have no clue what they did as an inciting event. It wasn't like some big trauma with, a football accident or a jet ski or whatnot. It's typically due to a slow disc degeneration that results in a tear with the inner part squeezing out. A person may wake up out of bed with it or sneeze and have a problem. Okay? The symptoms of sciatica are going to vary. It results in a pinched or irritated nerve root that gets inflamed and may cause leg pain, burning, pins and needles sensation, some numbness, possibly some weakness, and rarely incontinence. This is a surgical emergency, actually. Here's a picture of some weakness, potentially foot drop, where it's tough lifting up the foot. Initial treatments for sciatica should include a short period of bed rest. Studies have shown that anything longer than a few days is detrimental. So as soon as a person can get up, 24, 48 hours, and start walking around is best. Over-the-counter medications such as anti-inflammatories and Tylenol, physical therapy, chiropractic, spinal decompression therapy, which is computerized intermittent traction, all those can be beneficial. Prescription medications include potentially a Medrol dose pack, which is a burst of prednisone for about 5 days. It tapers off. That can be helpful. Narcotic medications, muscle relaxers, and neuropathic medications, which include the likes of Lyrica and Neurontin. Interventional treatments may include trigger point injections to help with the spasms in the back, and then epidural injections are the gold standard. Those have been done for over 50 years, and that involves placement of numbing medicine and steroid around the area where the nerve root is getting pinched. It bathes it and soothes it. Doesn't fix the problem, but it can provide excellent pain relief for weeks to months. There are 3 types of indications for sciatica surgery: absolute, relative, and quality of life. Let's go through these. Absolute is when you have cauda equina syndrome. This results from compression on the remnant of the spinal cord with a huge herniated disc. This can lead to irreversible incontinence and difficulty walking. So at the first sign of this happening, and here's what you see here is a large disc herniation pushing on the dural sac, okay? That needs to be treated emergency, like within 24 hours definitely, so you don't get irreversible symptoms. Now, when you get to relative indication, what that means is you don't have to have surgery, but you should highly consider it. One of the issues is motor weakness. So if you have a foot drop and it's trouble lifting up the foot, you can watch that for a while, but the question is, when does it become too long to watch it? If you watch it for 6 weeks, okay. If you watch it for 3 months, what happens if you go and do the surgery at that point? It's a technically perfect surgery. The foot drop may never get better. So you just don't know when it's going to be too long. If the foot drop is getting worse, whatever muscle weakness we're talking about, then that becomes a relative indication for surgery as well, because what it means is that the compression on the nerve is probably getting worse. Now, when you start talking about elective quality of life, this is really just because of pain. It's not because of motor weakness or incontinence. You're really just having pain that's not getting better. So if it's over 6 weeks of conservative treatment with the ones that we've talked about, injections, medications, PT, chiro, then a person can start thinking about undergoing surgery. However, studies show that at the 1-year point, if you have surgery, if you don't, and if it's for an elective indication, the outcome's the same. So it's better if you can avoid it, if at all possible. Less than 10% of patients will end up needing surgery for sciatica. Over 90% good to excellent results go along with the discectomy procedure. But, as I mentioned, the study in 2006 showed that identical outcomes at 1-year point. So surgery did help increase mobility and decrease pain faster, but the outcomes were the same at 1 year. The top non-operative pain management in New Jersey is through the New Jersey Pain Network. There are several affiliated clinics throughout the state, accepting over 50 insurances and providing over 25 different treatment options with the board-certified, award-winning doctors. Visit us online at newjerseypainnetwork.com and then call us for more information and scheduling at 844-2NJ-PAIN. I'm Dr. David Green with the New Jersey Pain Network. Your pain stops here.